Quality Care for Children has been around for more than 40 years, and we work primarily on two priority areas. One is quality, making sure that children are getting the early learning experience that they need, and the other one is access, helping parents find and sometimes pay for childcare.
I always wanted to be a mom, and I always wanted to work. And my husband and I sort of shared and agreed that we both would work and that we would find childcare that we felt like would be even better than what we could provide.
I think when families are looking for quality, it's a difficult concept to measure.
It's really two key ingredients. One is people, and two is the setting.
Relationships with the teachers, the families, the children, the natural world.
One of the challenges with childcare is the whole childcare business model. The fact that what supports a childcare program's operations are the fees charged to parents, and parents can only afford so much.
Finding childcare was almost a full-time job.
We have 8 spots for infants, and we have a wait list of about 50 for those 8 spots.
Right now, programs are reeling from the pandemic. There is a staffing shortage. It's difficult to find staff, particularly staff who are well-trained.
We can't sustain quality programs without quality, skilled early child caregivers and educators. That's one of the most important elements of providing quality care.
It's incredibly hard right now to do hiring in early childhood. There are not enough qualified people, but beyond that, there isn't a wage, a living wage.
The pandemic affected my business with less revenue. In the meantime, we just keep going, just keep working with the same passion, with the same love, with the same commitment for those kids.
I think it's very important to note that the problems in childcare, the challenges that we have, were here long before the pandemic. So that kind of suppresses the quality, and it suppresses the ability of the childcare program to be sustainable.
And if we don't have these people advocating for us, providing us with opportunities to fix our back office, help us get into marketing, help us to be able to tell our stories and strengthen other providers. Without them, we're really going to fall at the wayside.
QCC Works helps support the sustainability of childcare programs in several different ways. We have an online web portal where providers can go to get access to negotiated discounts on goods and services that they use. They can also get business tools, budgeting tools, HR tools. We have the Provider Business Exchange, which we launched actually during the pandemic. That is a place for them to go for advice and information. And we made it a priority during the pandemic to track down every bit of funding that could help programs and to post it on that site.
We receive funding through Quality Care for Children with the food program. So that's a monthly reimbursement that we get for our food expense, which is an incredible benefit to our budget and allows us to spend more money on teacher salaries that way. So that's been wonderful.
I think there are several things that policymakers could do to improve childcare in Georgia. One of those things is a wage supplement for childcare teachers, and we have a model of doing that in Georgia. A second thing that we can do is to make sure that childcare teachers, if they're going to make so little that they qualify for public benefits, make sure that they receive those public benefits, and make sure that any increase in wages don't result in them losing those public benefits, which is known as an income disregard.
I have a lot of hope about where we're going to be in a year, but that hope has to be met with actual actions and policy changes and policy stakeholders to really, again, continuously invest, to have conversations about what needs to do. So I'm looking forward to the future of the school and to our community as a whole with real conversations met with real actions.